Wall Street to State Street, the final word on today's numbers and all the day's business news. This is Business Day, brought to you by Comcast Business Class.
The future of medicine and health is increasingly moving toward personalized care. More and more doctors are able to target treatment and preventive care to patients based on their specific genetic makeup. Genetic tests can help patients keep a disease at bay. Waltham, Massachusetts-based Interleukin Genetics is creating genetic tests that you can take at home. CEO Lou Bender joins me. Lou, thanks for being here.
Pleasure.
Appreciate it. Hey, first of all, tell us about Interleukin Genetics.
Well, the company is a direct-to-consumer brand testing company, and what we do is we have a genetic test that can help you predict your risk for getting heart disease, a very serious disease. It kills more people in the United States than any other disease.
Now, most of this is based on the fact that inflammation plays a huge role in disease.
Absolutely. In fact, all of the diseases of aging are now being associated with inflammation. You're talking about heart disease, cancer, diabetes, osteoarthritis, osteoporosis, rheumatoid arthritis. All of these diseases are now being associated significantly with inflammatory processes.
Now, how many of these home test kits are on the market currently?
Well, we have 3 kits on the market to measure varying degrees of risk for 3 different diseases, actually. We have one for the periodontal disease, which
is a gum disease?
It's a gum disease. It's called a PST test. And we have 2 Jinsona brand tests that are marketed by our partner QuickStar Amway. And one is to measure your risk for heart risk, coronary artery disease, and heart attack, and another is to measure your general wellness and regards to nutrition.
That's pretty remarkable. Now here they come packaged thusly, and these are still sealed, but I have one here, and this is the heart genetic test. Now let's take a look at what this involves.
Right. Well, essentially what we have with the Jinsona Heart Health Test is it's a very simple test to do. We give you a DVD. We give you all the necessary tools, a step-by-step guide. We give an informed consent. And it's a very simple test. All you do is you take a buccal swab and you swab the inside of your cheek with the Jinsona brand test, and mail it off, send it to us. We then have a centralized laboratory that's been approved by the CLIA regulation, so it's a very high-quality laboratory, and we can then conduct the test and send you the results back in 2 weeks.
It's as simple as that, just a brief swab of your cheek.
Simple brush of the cheek for 5 minutes, let it dry, mail it off, and we do all the work.
Now, what happens when the patient sends this off to you? You send a report back, and then what? Presumably the patient takes that to his or her personal physician?
Right. Well, what we're doing now is we're actually revising and revamping the entire report process since I've come on board. What we will now provide the person is a quantitative assessment of their genetic risk. So you might be 400, 500, 700% higher risk of developing a heart attack before the age of 60. That's what our test will allow you to identify. We give you the information on that risk. We tell you how the test was done, and we tell you all of the American Heart Association guidelines for reducing your risk of heart attack and reducing your risk of coronary artery disease. We also then provide medical literature for you to take to your doctor.
Lou, where are these test kits available?
These test kits available right now are distributed through our partner QuickStar Amway. You can Google Jinsona or QuickStar, Q-U-I-X-T-A-R, and then look for the Jinsona Heart Test. Jinsona is G-E-N-S-O-N-A.
So are these available at your local drugstore?
Right now they're available through the Amway QuickStar distributorship. We're looking now to go outside the channels, including to the drugstore. We want to go direct to consumer through a number of other vehicles, and we're trying to broaden the exposure and the way that people can get this test.
That's pretty remarkable. How many of these have been out there already? I mean, are you getting a big response?
Well, you know, we've sold quite a number of tests already. Tens of thousands of people have benefited, but we have now decided that the best thing for us is to give a lot more information on the test. Previously, we've just said you're positive or negative. Now we're going to quantify how much that is. We're going to tell you what to do. We're going to tell you the science behind the genetic test.
And just quickly, is there a charge for that test?
Yes, there is a charge, right? It costs about $199 to get the heart health test, and somewhere around $150 to get the general nutrition test.
Good enough. Lou Bender, CEO of Interleukin Genetics. Fascinating.
Thank you.
Thanks very much.